Time now for this week's Health Matters, along with physician assistant Lynn Szabo. And today we're talking about birthing.
Yeah, specifically some kind of sad news, but also opportunity for better.
All right.
Which I'm excited about. But it's going to super affect Del Norte County, and nobody has really figured that out yet. So the sad news is the birth center at Mad River Hospital in Arcata is closing.
Mm-hmm.
And I think there was a meeting on August 21st of the providers. It was a routine meeting, and then this was kind of dropped on them. And
really?
I think at that point they were going to end at the end of September.
Mm-hmm.
So not much notice. Now I think, although it seems to change a little bit, it seems fluid, they're going to end at the end of October.
Any idea why?
Yeah, they're losing $1 million a year, and the hospital cannot sustain that. Yeah.
So, and how many people will this affect? I like doing this sort of math. How many people do you think this will affect?
I can tell you about Del Norte.
Okay.
That UHS sent down about 25 people a year.
So 25
to be
people.
Delivered
25
there.
people. So divide 1 million by 25.
From Del Norte.
From Del Norte.
Just Del Norte.
And that'll get you in the neighborhood of how much your life and the life of your unborn child or your being born child is worth. There you go.
Yeah, that's 2 people, actually, 1 family. So,
jeez.
But remember, this birthing center is also used by the Open Door prenatal program. They don't really have that program up here, but that's kind of centered in Humboldt County. And that's a lot of people.
Yeah.
It's also used by the lay midwives and the home birthing midwifery practices.
I would imagine a birthing, I don't know what to call this, institute, a center. There it is, the birth center. You have to have a very kind of specific series of connections if you're dealing with doulas, right? If you're dealing with midwives, if you're dealing with folks, I mean, that just doesn't happen with every hospital, right?
Right.
Yeah.
That's the whole point.
Yeah.
That's why everybody's so shocked.
Yeah.
There are no doulas and no lay midwifery connection at St. Joe's, nor are there at Sutter.
Mm-hmm.
And I think the next closest hospital that kind of offers those similar services is Ashland.
Wow.
Yeah, that's nuts. Dr. Roxanne Alsbury, well beloved to the Del Norte community, who went off to get educated and then came back and landed in Ashland, has graciously, and we'll talk about that, but graciously invited some people to enter her practice.
Wow.
But that's insane. And I'll get to why I think that's insane. Mad River is the only hospital that does water births, which is really important to some women.
Wow.
And it is a super nice choice for Native women, and then women who want small, intimate births, who are not expecting necessary, they're low-risk pregnancies, otherwise healthy women, not really expecting too much in the way of excitement, medically. There's no medical drama, at least anticipated. And they're just hoping for a nice, quiet entry for a new person for their family.
How is it responsive to the needs of Native women?
Well, they have Native doulas. UHS
sure.
have Native doulas.
Okay.
They're not up here because Sutter doesn't allow them, and it's still kind of a new program, still growing. But it's super important to Native women. That is a big selling point. To water births are not even as important as that.
Yeah, I would imagine here especially. Yeah.
Now, we talked about the lay midwifery community. There are a lot of lay midwifery practices in Humboldt County, but there is one here. There's one in this county, and my understanding is the practice is undergoing transition as one midwife retires, and then her apprentice is elevated to, the main deliverer. So that's a lot of people. But this news, like I said, was announced at a routine meeting, and oh my God, the texts were flying.
I bet that's a bomb going off.
There were
room, right?
most of the doctors, this was a routine meeting, okay? So if you're lucky, if you get like 25% doctor attendance. So most of the doctors weren't even there, and they're all shocked.
Wow.
They're utterly shocked.
Now, have you seen any sort of announcement about this from Mad Rivers just in the media?
Well, it's in the
Humboldt?
media. It was in Loco within a day. Lost Coast Outpost. And I assume that
But it hadn't, the outrage, you think, hasn't trickled, or at least the alarm hasn't trickled up here?
I don't know if it was posted in Wild Rivers, because it's not seen as a problem up here.
Right,
But
it's
it
not-
very much is. That's why we're talking about it.
Okay.
And then there's sadness. But here's something that was kind of exciting that happened. And kudos to the administrators of both Open Door and UIHS. I got an email that asked me for my wildest dream in the light of this situation. What is something that UIHS could do that is closest to your heart, that you would love to see
In the context of this closure?
in a context of this closure. And so I think that the community clinics are, I think there's a possibility that they could join together, or one of the community, or they could be separate components, but they could, kind of step into the existing staff and resources of the birthing center and be like, Mad River would be like the landlords, or maybe have some administrative help, very similar to what they do in the emergency rooms. So the emergency room care at Sutter is administered and overseen, and the resources, the actual like bathrooms and, splinting stuff and x-rays, all that stuff is administered by Sutter, but the doctors are a separate little Lego.
Right.
Yeah,
right.
and they get clicked in there.
Yeah, like
That's why we see a lot of doctors that are from out of the area, and we're a rural community. But they could do something like that. And I don't know if they would, and I don't know what the barriers to that are, but they are entertaining the possibility. And this is why I wanted to talk about this today. If you are a part of a birthing family or a birthing woman, and you want to put your 2 cents in on this would be a really good time to get some administrative contact. And up here, that would be Annabelle Dominguez for Open Door. She's the center manager for the Del Norte Community Health Center, and it would be Barb Pfeiffer at UIHS.
Okay.
And, UIHS is going to be interested in Native women's opinions or Native family opinions. And then Del Norte, of course, anybody who's a patient there, because we have Dr. Parker who takes care of all those lovely newborns. So that's through Del Norte Community Health Center. Now, I don't know that Sutter's too involved in this. That would be kind of a conflict for them. I can't imagine that they would be involved, and I don't know what Stallant has in mind.
So yeah, I
can
can
speak to that.
So again, I want to go back and revisit. I just saw something here in your notes that you, and that was this. We all understand this was an important, or is an important center, and had lots of connections with women in Del Norte, women and children in Del Norte. But how specifically? I mean, why should people in Del Norte care about this? You can go to Sutter and have a baby, can't you?
Because right now, a lot of the women who were targeted to deliver at Mad River are kind of, their care is, what's being thought is that they're going to deliver mostly at St. Joe's.
Okay.
Some at Sutter, but mostly at St. Joe's. And St. Joe's, this is a huge influx of people. Del Norte, that's 25 women in 1 year. That's kind of a lot. And the other thing is that they've got to have the logistical structure around it to be able to accept this. And it's not like the babies are going to wait until your doctor gets privileges at Joe's.
Yeah, right.
You
true.
know,
Yeah.
They're on a different timeline. Babies come when babies come, but we're also, they have to credential the physicians, which is, some are credentialed already, but that's a process that takes months. In some cases, they're going to have to do things like maybe open more rooms. because right now they don't have enough rooms for a woman to be in a private room post delivery. So there's going to be like more room sharing, which is not optimal. They don't even have enough computer stations to have all the people that are going to need to chart. My assumption is that they're going to be hiring and onboarding nurses from this group of people who worked at Mad River who are now probably unemployed as of a certain day. But think about what we're asking for women from Del Norte to do if they're going to deliver at St. Joe's. If they're lucky, they have willing family members who can take them in. You know, again, babies come when babies come. All right, a due date is a guess, kind of as educated guess, but it's a guess. But what if you're driving? What if your due date is like the middle of February?
Right.
You're on the bypass at night. Babies like to start to their process at night usually. What if the weather's bad? What if the slide's down? What if there's a tree down? What if you don't have the kind of car that can cross over black ice over the bypass? We've had no bypass babies.
Yeah, that's a good thing, right?
Yeah, but
but just to be clear, isn't that the situation now?
It's not necessarily. You have a little more choice when you have another birthing center, and for some people, especially the Native families, seem to have a lot of extended family in McKinleyville and kind of Blue Lake Arcata area, and who are willing to let people either come down and park a trailer in their driveway or, stay in the guest room.
Yeah.
But just the amount of time it takes to get from Arcata to St. Joe's in Eureka is, that's a little difficult if somebody's going through transition or something. There's just less control of the process. So current options right now include delivery at Sutter at St. Joe's, maybe into Oregon. I don't think that Gold Beach delivers, although they do have an OB program, but I think oftentimes those people are delivered at Sutter. And although really appreciated, Dr. Ellsbury was all excited about offering the program she has in Ashland. And some women who have family in the Medford area, that sounds doable.
Yeah.
But still, that's the same problem. And with an added problem if somebody has partnership, which is California Medicaid.
Yeah, then you're nothing.
Yeah, then that weird disconnect between Oregon and California pretty much makes your insurance moot.
So it seems like with this closure, there, as you were saying at the beginning, the way it could lead to good stuff is that we have to sort of backfill this dearth, and we might be able to do that totally locally here in Del Norte.
Right. There seems to be some interest, although I'm not in those meetings. But
why aren't you in those meetings? You should be in those meetings.
No, I should be seeing patients. I'm not.
Good answer. There you go.
No, I don't want to be an administrator.
I know what you mean exactly.
These people are much more in the know.
Right.
For me, I would be giving it away. So
yeah.
these guys have to keep the doors open in a very real financial sense. So, but here's the other thing I don't think has been discussed, and I think this could be a problem. If I was a young family practice graduate looking for a community to live in, and I had an OB interest and also had some skills, let's say ability to do C-sections, then I would not be as attracted to, say, Humboldt County, where there's only right now one hospital doing OB, because they also closed the Fortuna part of St. Joe's to OB.
Wow.
So there's one hospital that I'm aware of that's doing OB purposefully and not by accident. And then up here in this county, there's one hospital that's doing OB. That's not that's not enough resources to attract somebody to come here.
Okay, so I don't understand the dynamic involved there. Isn't there some like young doctor, just fresh out of school, wants to go be the first, or that's not a thing?
No,
Is that
that's
how it
not a
works?
thing.
Okay.
They want to have they want to have backup. They want to
Okay.
have resources, and so
They don't want to be alone in that endeavor.
right.
Yeah,
and
yeah.
and they shouldn't be really, because you still learn even
Mm-hmm.
after school. So that we've talked before about why Del Norte is unattractive to specialists. Here is a very concrete example.
Yeah. Yeah.
And so OBGYNs, why would they go to Arcata?
Mm-hmm.
They have to live, if they're delivering, they have to live within a certain time radius
Right.
of getting to the hospital. And so and I don't think that can live as far away as Arcata. That might be on the boundary a half an hour.
Wow. Okay.
So that means that they're not necessarily living in, the best areas that might be the most attractive areas to them.
Mm-hmm.
Okay. They like university towns. They like
Right.
being around that. So no diss to Eureka, but it's complex.
Mm-hmm.
And if you don't have the resources, then that's a downward spiral, and that's not going to attract new talent at all.
Yeah.
That's the opposite. And then whoever else that's associated with OB care, like OB nurses,
Mm-hmm.
things like that. So they also have this beautiful facility that already exists. And I'm not sure, there was no discussion about what they were going to do with it, but I think they're hoping that somebody's going to step up and plug into it.
Oh, so they might be anticipating that kind of ER
Right,
scenario.
that ER model where it's like Legos,
Right.
Yeah, you build a structure and then plug in the
See, but now you've got me
physicians.
thinking about the efficacy and just the downstream benefits of having a center like that here in Del Norte, so that even if that center reopens or stays open with a new vendor, let's say, providing care,
Right.
it seems like we should still have something going on up here.
Gosh, I would hope so. But right now, after Dr. Ridley left and Dr. Kirk is here and being super beloved to the community, also one of the other practitioners who speaks Spanish. But they don't have another OB provider that's committed to being here full time. They have travelers going through, and women find that difficult, even though the actual delivery part is really a small part of OB care. But they want somebody who's known to them, who they have some ability to pick, they might have a gender preference, somebody who's going to be there and explain, they have a connection with, and that needs to be built up in this community.
In a lot of ways, too, this sounds like a conversation that we had recently about end-of-life care,
Right.
in which case that human connection becomes
Right.
very, very important. It's the same thing for beginning-of-life care, too,
Right.
and OB care in general.
Yeah, and that's super, the grandmothers, when they come in for initial OB visits with their, pregnant relative, they had a model that was very different, and they are shocked. Shocked to hear that there's so few resources. And it's complicated that, like, the two computer systems don't talk to each other, UHS and Sutter. Now that's changing, but that stuff changes glacially, like really slowly. And right now, it's pretty much me walking records over paper records. So
Pick up the pace, Lynn. Come on.
yeah, there you go. That's my Friday night gig.
Yeah.
I just bring the whole week over, which is good because that it's nice for them to know who I am, and we sit there and tell war stories, and it's fun. But there was a baby that was born in Klamath because somebody couldn't get to care. And this highlights not just Del Norte and maybe not just Humboldt, but a lot of rural communities. They just don't have the resources to take care of the people that are here. And they're not apparently money makers, which is like infuriating.
Yeah.
Right.
Because again, you come back to that math where your life is worth this much.
Right.
Nobody says it out loud or completes that
Right.
thought, but that's exactly the thought that's involved there. We're
However-
cutting healthcare because of this amount of money. You
Right.
make the connection.
Yeah, exactly. However, crisis being opportunity.
Yeah.
I see some, I'm not involved in these talks at all. Like I've said, I'm busy seeing patients, but I've seen the doctors come together, and I've seen a lot of bright minds working on the problem. And I think there's willingness to think outside the box on this one and, make the resources available for Del Norte women. And it's super exciting.
That is exciting.
Yeah.
Okay, so what can a concerned citizen, Jane and Johnny Q. Public, and or especially a concerned expectant mother, do now? It looks like the date that's in your email here is that the center, the birthing center, stays open till it looks like Halloween.
Yeah.
And then nothing. So between now and then, what can a local person with skin in the game do to put their shoulder to the wheel of perhaps getting some sort of expanded access to a birthing center here in Del Norte?
It depends on where they're patients, but yeah, I think I would talk to Barb Pfeiffer, who is the center manager at, and actually more like a regional manager, but her actual office is in Crescent City, UHS. And she's very accessible. People talk to her all the time about concerns they have in the clinic. This is an opportunity. She is a can-do woman. She is a visionary, and she would love to hear from you. And then same for Del Norte Community Health Center would be Anabel Dominguez, who's also their center manager. They don't really do OB here in Del Norte, but they do take care of babies because Hannah Parker's the pediatrician, of course, there. And, they are interested in making noise and solving this problem.
And
this birth center is not going to die quietly.
Good.
Yeah.
And what would you have somebody say to these people if they got a hold of Anna or Barb? What would you have? That
somebody? It's my nightmare to be stuck on an icy road in the early morning of a February snowstorm, and having my partner or my auntie or grandmother or whoever's driving me, trying to deliver a baby, knowing that I can't get the care, like even my healthy pregnancy needs to deliver this child safely.
Wow. Yeah. Okay.
So.
All right. Well, hopefully folks will make that connection and get themselves heard, and something can happen from this. Wow. That's just got to be so frustrating for us, because your specialty is OB, right? Or is it just
I wouldn't say
unofficial?
It's my specialty, but it is what the community has asked me to
The
do.
community has asked
Right.
that. Okay.
And I don't deliver. I do OB care for stable, healthy women. But I've got this practice of young growing families, and I am fiercely defending them every chance I get. So, and I don't think that they necessarily know what's happening. I don't even know that there's been any local news on it.
Right.
The same thing happens. It's like a terrible thing happens in Humboldt, and Humboldt obsesses about Humboldt, and Del Norte is equally or maybe worsely affected. And we're just getting used to being beaten down, I guess.
Well, yeah, we've always been used to that. But no, Redwood Voice Community News is on this. I've got this as a list of stories to talk to the kids about this coming week and this month, because big things are changing for us on that end, on this end, on the news end. And we'll be doing a lot more firsthand reporting. And so this is one of the first handful of stories that
super exciting.
Yeah, we've got a couple of people I want to get involved with this. We even have a volunteer here at KFUG who used that birthing center. And you saw the child that resulted earlier when they walked through the house, and that is.
I used that birthing.
You
center.
used that.
She's
birthing
32
center?
now, but yeah, it has been available to the communities for decades.
Wow! Yeah. Man.
Yeah, this is an important part of us that we don't really think about.
And you're right; it's a weird sort of disconnect between Del Norte and Humboldt in this regard. Something that affects a specific subgroup of folks in Humboldt, that then there's that lends itself to a further cutoff from
Right.
that
People
specific
are
subgroup here.
enraged in Humboldt, and then up here, it's interesting. They talk about it as the deficiency in care that rural communities suffer. So it becomes much less personalized.
It's a little more, a little
Yeah,
more
it's kind of funny.
kind of headline like that
Yeah.
then. Well, all right. Another headline that's going. We've got just a couple of minutes here left. You're heading up the road to the homeless walk-up clinic today. How's the scene happening there?
Oh, it's pretty good. It's usually Dr. Turner, Andrew Turner is there, but he's had reasons why he hasn't been able to. So I've been doing it lately, and it's fun because we all know each other. Right?
Yeah.
It's given me an appreciation for how big the swamp is, and there's apparently different swamp subdivisions that
Yeah.
I didn't understand at first, and what their needs are. I've definitely seen pregnant women there.
Yeah.
Mostly to tell them, how to get care. I know people are hungry there. I know that they're worried about the winter because it's going to be cold this year. So they could use, things like warm clothing, jackets, sleeping bags, tarps, rope, stuff like that. I know they immediately go to the coffee. And after they get their first cup of coffee down, they look through the clothing. So if you've got a bunch of clothing, that you were wondering what you were going to do with it, you can bring it down there Sunday from noon. Usually, I'm going to be there noon to 3 today, but they're usually there noon to 4. And I know that stuff is appreciated.
That was my next question. Is it's okay to stop by there on Sunday and not go through Open Door?
And there, well, you could do either, but there is behind the Superette.
The Superette at the corner of Howland Hill and Elk Valley Road.
Right. It's one of my favorite practice sites I've ever
Really?
had.
Really?
Yeah, there's
Just
an abandoned commode within sight.
We drove by. Lisa and I drove by. We'd coming down the hill from being up in the redwoods last week, and drove by and we saw it. It was late in the afternoon. Everybody just kind of sitting around in the back, like talking under.
Exactly. Exactly. And they do have some food, and I see people pounce on that early. It's almost like people do their weekly grocery shopping on it.
Oh, wow. Okay.
Yeah.
Okay.
And there are, homeless kids in the swamp. There are pregnant women. There are people who never saw themselves as, ever ending up homeless. Oftentimes people involved in fires or fire refugees are there.
Really?
There are a lot of really, really sad circumstances, but people demanding recognition as human beings. And they could certainly use the help. Food deliveries are okay. We pack bag lunches for them, et cetera, et cetera.
Wow. And other avenues to help through Open Door and Mission Possible?
Yeah, Mission Possible, always a good place to offer. Even volunteering would be helpful.
Right.
But if anybody wants to come down and bring a grill and cook up some hot dogs or something, even that, it's super appreciated.
Wow.
Plastic bags.
Really?
Those ones you got from the grocery store that you're like, I don't want to throw these away because I'm a good ecologist and I know they're destructive. Yeah, you can bring them down there. People need them down there. I know. I thought it was weird too.
See, as somebody who lives adjacent to the swamp,
Yeah.
I would argue for fewer plastic bags blowing around this part of town.
Okay. Old cloth bags.
There you go. Bring old cloth bags. That's it. Bring a backpack.
Right.
There you go.
Yeah.
I got a few of those actually. I'll
Or
run
a
those
blanket
down.
that you could tie stuff up in hobo style.
Oh, a
Yeah.
bindle? A bindle? That's no. Oh my gosh! All right, well, Lynn, thank you for doing the good work up there and helping out today this afternoon. And I guess that's it for this week's Health Matters. Again, if you care about babies being born,
And you should.
or have ever been one yourself,
There you go.
then get involved and let local folks know what you feel about the closure of the Mad River Birthing Center, or the birthing center at Mad Rivers Hospital down in Arcata. Anything else, Lynn?
Nope.
Okay, well then we'll talk next time for the next Health Matters.
All right. Thank you.